Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast, video podcast. We are here once again with Dr. Zahra Figueredo. Hi, how are you, doctor?
I'm very well, Louise. Thank you so much. How are you today?
I'm doing great.
Great.
So we do have our weekly podcast, and today we're going to talk about sexual wellness.
That's right.
And this is a very important topic for all of us, men and women. So, but I do have a few questions here, doctor, that sometimes we don't like to ask because of the topic. But I think it's very interesting how the stem cells can help us in this particular issue. I wouldn't say illness. You correct me if I'm wrong.
Mm-hmm.
But I would like to know, why do we think that sex should be less when we are older, and we should have a steady sex life, I think.
Right.
Even if we grow older, right,
Yes.
doctor?
Right. And it doesn't even have to do with age. Age can be a reason, or some kind of disease or dysfunction. And so your question is a really good one, Luis, because yes, a lot of people just figure that, okay, I'm getting older, I'm only expected to perform this often, or perhaps to a certain degree, and so on and so forth. And with age or with disease conditions such as Peyronie's disease, which is almost like a scarring of the penis in men. And then there are other factors that contribute to dysfunction in men and women. And that shouldn't be the case. In fact, there are all the different factors that can lead to any kind of sexual dysfunction can be addressed. And it's really important that stem cells do that in the correct manner, in the way that they're deployed, and considering all the different factors that are at play. So it's really important that we don't. It's not just a single pronged approach. It's a very multidisciplinary approach.
And how does this manifest in men and women? Sexual dysfunction in this case.
Right. So let's start with women. In women, usually it can be, again, factors such as hormones, and the hormones can contribute to vaginal dryness. It can contribute to a decrease in libido. There's a decrease in blood flow to the region, or angiogenesis. So a lot of different factors can manifest, and also muscle tone. So women that have had children, there's a lack of muscle tone. There are a little bit of dysfunction in that sense. So that can contribute to sexual dysfunction in women. In men, we have diseases such as that I mentioned, Peyronie's disease, which is a scarring in the penile tissue, as well as, again, hormonal, as well as even cardiovascular disease or diabetes, where there's a decreased blood flow to the region due to different factors, whether it's diabetes or cardiovascular disease. And then we have to also remember that in both men and women, there's a huge psychological factor, and mental, emotional, psychological factor that absolutely, even if everything is working right, anatomically speaking and physiologically speaking, if the mind and the psyche isn't there, it won't work. So it's really important that we address all these aspects of a patient's well-being when we're speaking of sexual wellness.
And now to get into the topic of the stem cells, how can the stem cells help tackle all these issues?
Mm-hmm. Thank you for asking that, Louise. So the stem cells themselves, allow for regeneration of damaged tissue. So when we have diabetes, and there's damage to nerve cells, there's damage to the blood vessels themselves in cardiovascular and diabetes, cardiovascular disease and diabetes. When there are hormonal issues, when there are muscle tone issues, all of those can be addressed with stem cells because they go in and regenerate the damaged tissue, whether it's a muscle, whether it's a blood vessel, because stem cells have been shown to increase angiogenesis, which is the production of brand new blood vessels, and then, of course, regenerate the ones that are already there. So that in and of itself is how stem cells can help with sexual dysfunction, in that they go in and regenerate the damaged tissues that may be playing a role there. And then, of course, we address everything else as well as a clinic.
All right. And do you take any other steps besides stem cell therapy to help people with these type of issues?
Yes. What we do is, so as stem cells, in the way the treatment goes, we will hit the patient hard with the stem cells with themselves, with the correct numbers, with the viability, in the way that we deploy them, because they will be deployed intravenously as well as locally, which is really important. And of course, this is done under a conscious sedation and local anesthetic, so the patient is very, very comfortable. But that aside, which is of course a given, it's really important, as I alluded to earlier, that we address the patient as a whole. Now, there could be hormonal issues at play. We have perhaps a menopausal or menopausal woman who has hormone issues that are contributing to this. And then we have psychological, as I mentioned earlier. We have diabetes, we have Peyronie's disease, we have cardiovascular disease where there's a decrease in blood flow to the anatomical regions. So we have to address all of these in conjunction with the stem cells themselves in order to get the best possible results.
So it's basically finding the root of the problem, so we can apply the right stem cells. Do you use some specific stem cells for every case, or do you use the same type of stem cells?
Louise, that is an important question, because if we're dealing with erectile dysfunction, for instance, caused by diabetes, and if we want to address the diabetes, which is pretty much the root cause of the erectile dysfunction, in that case, we will use endometrial stem cells combined with autologous adult mesenchymal stem cells, which usually we grow in vivo in the bone marrow, which is our proprietary method of doing it, and it works phenomenally well. And the reason for the endometrial stem cells is that they address autoimmune conditions very, very well. And if this is if we're talking about a diabetes type 1. If we are dealing with cardiovascular disease, we will ensure that we're also addressing heart, the aspect of the heart and the heart organ itself. And that again includes systemic IV. If we're dealing with nerve damage, and again with diabetes, going back to diabetes, we see so much peripheral neuropathy, and that's basically nerve damage, and so we have to address that locally. And so depending on what we are trying to address in that respect, we will use specific stem cells to address those issues and those that etiology specifically.
So even this is a very uncomfortable topic for many people. It is important to seek treatment, right, doctor?
That's right. That's right, because we have to remember that sexual wellness, it goes way beyond just the physical and the, the pleasure we may feel, and it goes way beyond that physical aspect. It's about intimacy with a partner. It's about creating a bond with a partner, and when you're in a relationship, it's so much in a meaningful relationship. It's so much more beyond the physical, and so all of these, having a, a, a sexual, a healthy sexual life and lifestyle with your partner contributes to all these aspects of a healthy relationship. So it's really important, and it's not just the physical.
And what do you think about these chemical pills like Viagra and I don't know what the others, because I don't use them.
Cialis, yes. Unfortunately, it's a quick fix.
Uh-huh.
I have seen that even in patients without the psychological and emotional aspect having been addressed, those pills may not work.
Mm-hmm.
And so it's very interesting, because the carnal desires and that psychological aspect indeed needs to be there, because we have seen cross, we call it using off-label, using a drug off-label, which means that it's being used for something other than what it's been FDA approved for. We have seen medications like Viagra being used in pulmonary diseases without the any aspect of sexual wellness in that context. So yes, so with those Viagra and Cialis, we have seen that without the psychological and emotional aspect in place, it won't work sexually. Okay. And as I mentioned, the off-label use. And also it can be dangerous in patients with heart issues and heart conditions, or high blood pressure, because it can increase blood pressure in heart patients and heart rate. And so it is important to consider all these aspects of using those types of medications for sexual wellness.
Okay, doctor. I do have to ask, as a man, do you inject these stem cells locally?
Yes, I alluded to that earlier. I didn't go into too much detail, but yes, absolutely.
Uh-huh.
It is done. It is done on point at the site,
Do
under.
you use any type of anesthesia?
Absolutely,
Okay.
yes. We have to ensure that. Yeah, we have to ensure that the patient is very comfortable, and we go to every length to ensure that.
Okay.
Mm-hmm.
Anything else, or maybe I missed something on this podcast, doctor, about this topic?
I wanted to mention what you sort of asked me about earlier, is the everything that we do as a clinic comprehensively to address an issue such as sexual wellness. So the stem cells we talked at length about, but also our total detox program that prepares the body, increases blood flow, um, decreases toxins. We do our nutritional IV cocktail for our detox program, as well as the coffee suppositories that work in conjunction, and B vitamin shots. And then we also do the hormone therapy. So it may be growth hormone, which is almost always something that we use with patients, as well as any other hormone that we may feel the patient requires after we do our screening of the patient with blood work and a medical intake. And so that may take the form of not only human growth hormone, but also testosterone, estrogen, DHEA, progesterone, whatever we feel is necessary. Also, we do the exercise with oxygen therapy, which is so important for oxygenation of the tissues and blood, again, oxygenating and blood flow to the areas, and allowing increased oxygenation through angiogenesis of and creation of new blood vessels, as well as the stem cell enhancement formula, which is a combination, a very personalized combination of herbs and minerals specifically geared toward the patient and what we're trying to address in the patient. And of course, last but not least, as I mentioned earlier, psychological, emotional, even spiritual well-being. We address that in order to, again, address every aspect of a patient's wellness and not just their physical body.
So it's never too old to get this treatment, right, doctor?
That's right. You're never too old. We have had patients, and we're happy to give testimonials of these patients because they're so eager to always speak to patients who were intimate for the first time after decades after having stem cell treatment, and that when they were in their 70s and 80s. And so that was quite phenomenal. Really, really happy to hear that. So we're happy to, for patients, prospective patients and listeners and viewers to contact us if they want to speak to any of our patients.
Exactly. And by the end of this podcast, you will find all the information how to contact Dr. Figueredo. And I would like to thank you for your time, doctor.
Thank you, Louise. It's always a pleasure talking to you.
I will see you next week.
Thank you.
Bye-bye.
Bye-bye.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.